Hey, you guys, welcome to day 19 of our March Madness practice questions. As always, I like to give my introduction and disclaimer before getting into the material for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources to assist nurses as well as nurse practitioners with being successful on boards as well as in practice. I've been doing this since 2015, helping nurses and nurse practitioners internationally be successful on boards and practice with tools such as my in person review courses, my online self paced or group courses, my review books, and my one on one sessions. So I provide a variety of tools just to meet you where you are and assist you with exam success. We work through various things just depending on your story. Some people are testing for the first time. A lot of my people come to me because they have been unsuccessful on boards previously and just need a little bit more structure and honing in on those weaknesses and making those strengths. And those one-on-one and custom packages really allow you to hone in on that or providing you with the structure that you can do individualized as well. So I just work in various ways to assist you guys. And I started really pushing more on some of these videos too to try to help you guys study on the go. So I know sometimes you're just trying to tie in those areas. So you'll see over the years I've done, comment videos that are just getting straight to the point. I'm big on short and sweet, eliminating the fluff because we've read the books, we know the information, but really just tying it together and making it make sense and making it stick, right? So you can have you're able to retain it. So a lot of my videos, you'll see that I do like that for like topics and tips. And then I do practice questions to help you tie it all together. But, with our March Madness series, I just really was trying to, as people are, it's about that season where we're getting into testing time, etc. Exit exams. So just trying to pump y'all up and gear y'all up and making y'all have this little extra on the go quick study to put your mind in that process to see where you are with things, strengthen that muscle memory, and get you into the flow of things. So I hope you're finding it helpful. But I always like to give the disclaimer that there's no absolutes in medicines. We know that we treat on a patient by patient basis. So I design my questions to meet the guidelines that they're currently testing on so that you can be prepared, you know what to expect, and you can kind of gauge and structure your mind that way. When I'm teaching on things that we're currently doing in practice, I will say that so that we can eliminate any confusion. All right, let's get into question number one for today. Number one. Question number one states an African American male patient presents to the office for follow up today. He has a history of hyperlipidemia, gout, and COPD. His blood pressure today is 156 over 86. The nurse practitioner discussed lifestyle modifications with the patient at his previous appointments without any improvement. Based on these findings, how should the nurse practitioner treat? Is it A, lisinopril, B, amlodipine, C, valsartan, or D, chlorothalidone? Take a moment and tell me what you got in the comments. All right, I always recommend that you read the stem of the question first so that it slows you down to ensure that you're answering what's even being asked of you. So the stem of the question here says, based on these findings, how should the nurse practitioner treat? All right, and I always tell you to study in the format of assessment, diagnosis, evaluation, and treatment because that's how they're testing you. I've been saying it for years. Trust me. So when you do questions, I want you to think back in that pattern because listen, this is what we do. This is how we practice. This is how we document our SOAP notes. This is what they test you on. It's the same pattern. So study this way. It's going to help you pass boards and it's going to help you in practice. It is going to help you document. It's just a cycle. Practice makes perfect, right? So when you are doing these questions, I always tell you to take it back. So if they're asking you how to treat, what do you need to do? You need to go back and see what the diagnosis is. If there's not a given diagnosis, you got to solve and figure out what the diagnosis is by seeing the assessment, right? How did they present themselves? What was the subjective? What did they say was going on? What is their chief complaint? What is your objective? What does it say that they observed? So it says, based on these findings, how should they treat? So we need to know what we're treating. All right. So it's an African American male. He comes in just for follow up. He has a history of hyperlipidemia, gout, COPD. Blood pressure is elevated today, 156 over 86. Looks like we are treating, hypertension, right? because the blood pressure is up. She's tried the lifestyle modification, so it's time that we go into initiating medicines. Um, so we want to think of first line therapy. So we know that everybody across the board, first line therapy, thiazides, and I think that since the hypertension guidelines, ACC and AHA guidelines released, people are beginning to get confused when we say first line therapies. So really, all of these medicines are what you can utilize as first line, but the one that they find the best results from are those thiazides. So if they ask you that initially, you're going to go with a thiazide. Remember, it's telling you here this patient is an African American male. The African American population does best with thiazides and calcium channel blockers. So even though you're knowing your first line therapy, you need to know your population too and how to treat. And it's also known that the African American population does better with thiazides and calcium channel blockers in combination. But if you are testing, you wait until they tell you, they're on the thiazide, now you need to combine one. But again, first line, we want to think the best is thiazides to go to initially. Now, if they are diabetic or have chronic kidney disease, we want to go with an ACE or ARB to protect their kidney function. This person does not have a history of diabetes, so we can really eliminate the lisinopril and the valsartan, because remembering your drug endings to help you in this, right? So pril being an ACE inhibitor. I have videos on medications if you need assistance. And then valsartan. Sartan is the ending for ARBs, right? So we can take A and C out. We know that we said African American population does better with thiazides and calcium channel blockers. So B is a calcium channel blocker, amlodipine, right? Because calcium channel blockers end in pine. And then chlorothalonone is at thiazides. Now, we would think, hey, let's go with the thiazide. Typically, yes, but you need to slow down and read what they have told you. This patient has a history of gout as well. What do we know about thiazides? We don't give thiazides to patients with sulfa allergies, patients who have a history of gout, with various electrolyte imbalances, because those are cautious and contraindicated issues. So the best answer for this patient here would be B, amlodipine, okay? All right, question number 2. The nurse practitioner is discussing anemia with the nurse practitioner student as they review lab results of a patient. The hemoglobin is low, hematocrit is low, MCV is normal, and the MCHC is normal. Based on these findings, what type of anemia do you suspect? Is it A, iron deficiency anemia, B, thalassemia, C, anemia of chronic disease, or D, B12 deficiency anemia? Take a moment and tell me what you think in the comments. All right, so stem of the question states, based on these findings, which type of anemia do you suspect? I don't know why I can't get that word out. But all right, so we're trying to think of what type of anemia. So, you need to think of how you categorize anemias. First, we know hemoglobin hematocrit will always be low if we are diagnosing them with anemia. That's first step, right? Then once they are diagnosed with anemia, you have to figure out which type of anemia they have so that you can treat adequately. Correct? So if you struggle with anemias, I have a video on the what I call my 2-1-2 rule to retain it on the top 5 anemias that we commonly treat. Your iron deficiency anemia, your thalassemia, your anemia of chronic disease, your B12 deficiency anemia, and your folate deficiency anemia. Well, here we need to figure out where we are with this. So hemoglobin hematocrit is low, so they're anemic. Now we're looking at the MCV and MCHC, right? So, that's where we get the cytic and the chromic. So the MCV is normal, so that's normocytic, right? And then the MCHC is normal also, so that is normal chromic. So which anemia falls in that normocytic, normochromic range? So your answer should be C, anemia of a chronic disease, because remember I always say in the 2-1-2 rule, there's 2 in the lower area, which is that microcytic hypochromic, which is your IDA and your thalassemia. There's only one that falls in that normocytic, normochromic range, and that's the anemia of chronic disease. And then the 2 in the larger range, the macrocytic normochromic, that's your B12 and your folate deficiency anemias. So normocytic pneumochromic, the only one that would be is your anemia or chronic disease, thinking of this because it's a chronic issue. So those values have normalized. And with anemia or chronic disease, it's something else causing this. And so then you just need to treat the source of that anemia. All right. And then question number 3. The nurse practitioner is discussing hepatitis B serology panel results. The HBsAg is negative, the anti-HBs is positive, the IgM is negative, the IgG is negative. Based on these findings, how should the nurse practitioner diagnose? Is it A, acute hepatitis B? Is it B, chronic hepatitis B? Is it C, immunity? Or D, normal findings? Take a moment and tell me what you got in the comments. All right, stem of the question states, based on these findings, how should the nurse practitioner diagnose? Remembering, all right, so if it's asking how do you diagnose, you take it back and you figure out what the assessment is. So what did you find? So they're discussing a hepatitis B serology panel. The results show the HBsAg is the surface antigen, right? So that's negative. So, I always tell y'all to look at the key things, the surface antigen versus the antibodies, right? I don't care how many things they put on the serology. Looking at those two is going to tell you every time whether they have it or they have immunity, right? Or neither. So here, the surface antigen lets you know if they have it or not. It's negative, so they don't have hepatitis B. But they are positive for the anti-HBs, which is your antibodies, right? So that means they have antibodies. They have immunity. So the answer is C, immunity. For it to be A or B, we would have needed the surface antigen to be positive, and then we would have looked at those cores, the IgM and the IgG, to see if it was acute or chronic. And we know it's not a normal finding. So the answer is C, immunity. All right, you guys, as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. If you may need any of our resources or services, any of our one-on-one sessions or our custom packages or our review books, or you just need a free consultation to see what you need, contact us at the Nursing Studio at 803-400-6864. You can shoot us an email at thenursingstudio1@gmail.com and take a look at our website at www.thenursingstudio.org, if you're just trying to see what we offer. All right, you guys, happy studying. Meet me back here. Bye, y'all.